Okay, so I'm going to demonstrate how to do an IV. So the first thing you want to do is verify the orders. Then you want to gather your supplies. So I'm going to need clean gloves, an IV start kit, has your tourniquet, tape, your Tegaderm, all the good stuff that you need, alcohol wipes, 22 gauge needle, a saline flush to prime the line with, and the extension tubing that will connect to the cannula of the IV. So you want to go into the room, introduce yourself, and explain to the patient what you're going to be doing, and answer any questions that they might have. And the next thing you want to do is place the tourniquet on the patient 4 to 6 inches above where you plan to insert the IV. And you don't want to tie it, you want to be able to get it off pretty easy. So, and then next you want to do your hand hygiene and then put on your clean gloves. And then the next thing that I like to do is go ahead and put the saline, make sure the saline flush doesn't have any bubbles, and screw it onto the tubing and flush it and set it aside so that I'm not fumbling with that while I have the IV down. So I would make sure there's no bubbles. There we go. And attach it to the tubing. And go ahead and flush it through. And there's a little drip in here, which is good. It means it's flushed through. And then I would just set that aside so it's ready to go when I need it. Right, and then I would get my tape ready. See. Sorry, tape and gloves don't mix very well. I would go ahead and I like to split it down the middle so that I have 2 different pieces. And I'll just set that aside for a second. Okay, so then I want to clean the site with alcohol. Make sure it's nice and clean. And then you want to let that air dry, not blow on it because you'll get your germs all over it. And then you would open your 22 gauge needle. And then remove the cap, and then I like to loosen it just a little bit because sometimes there's some glue on there and it makes it hard to work with. So you would insert the needle, bevel up 10 to 30 degrees angle, and then you would watch for blood return in the flashback chamber. And so you see a little blood return, and then you advance it just a little bit more to make sure you're in there. And then what you would do is pull the needle backwards a little bit because you're advancing the catheter into their arm. And then when you've advanced it out a little bit, you want to place the safety button to get the needle out so that you don't have a needle stick. And then you have the cath ready for you. And then you want to put that in the safety sharps box. And then I would screw in the tubing. And this would have blood coming out of it, usually with somebody's arm. So you would have your thumb placed above, about right here, to make sure there's no blood coming out of it. Okay, and then you would flush the line and look for swelling or puffiness or anything like that. I would be flushing the line, but it's not going to go through here. And then you would make sure that this is capped off and take your flush out. And then what you want to do is use your tape and ask the patient how they're doing, how they're feeling about it. Let me get my tape. So I'm going to tape right there. And then I like to put some tape under here and slide it down, and then kind of crisscross it back over so that I know it's really stable. And then I'll get my Tegaderm and I would place it. I don't want to waste this Tegaderm, but I would place it right over the site there, and it would come off and it'd be right above here. And then you would, of course, date, time, put the gauge, everything like that. And of course, you want to take your tourniquet off before that. And that's how you place an IV. And then to take it off, you want to make sure you're not hurting your patient when you take the tape off of the line. If I can get it with these gloves. And then you want to place the gauze right here. Put pressure down. I like to have them wiggle their fingers so they're not really thinking about it. And then you want to pull straight out. And then hold pressure here on the site. And that's how you remove it.